Is it recommended to take both SSRIs or an SNRI and ADHD medication if you have complex post-traumatic stress disorder and ADHD? I'm a clinical psychologist and let's break this down. If you have complex post-traumatic stress disorder and you have ADHD, these are two complex conditions that need a professional to manage it. With ADHD, you were born with it, and what this means is you struggle with executive functioning, things such as controlling your focus, concentration, emotion regulation, all affect your daily functioning. Now, complex PTSD, it is like post-traumatic stress disorder, but with post-traumatic stress disorder, it can happen after one event, like a car accident. With complex post-traumatic stress disorder, just remember the C, complex, is because it usually starts in childhood and it's the ongoing exposure of traumatic incidences such as neglect, abuse, traumatic circumstances. Yes, it can be common to have both because a lot of people with ADHD did grow up with trauma, or people with trauma, this does lead to developmental difficulties with how your brain typically develops. Back to the question, yes, it is safe to take both antidepressants and ADHD medication, which is usually stimulants, but this does need to be managed by a professional. The SSRIs and the SNRIs are typically anti-anxiety, antidepressant medications, which help boost your serotonin and your norepinephrine to help with emotional regulation and hypervigilance, which you experience in complex PTSD. With ADHD, it's usually a stimulant, which helps with the executive functioning challenges. But this is not the whole pie. You do need to get therapy and learn strategies to help deal with these conditions. Got a question on psychology? Let me know in the comments.